I'm going to do a quick video about how to put your 10 ml syringe of blood into the tubes accurately. So you've got your 10 ml syringe that you either pulled from an IV, butterfly needle, straight stick. I always use these Vacutainer blood transfer devices. It's the one with the pink top. There are Vacutainers with the blue top that connect straight to the IV, and you can just click it on and then you can pop your tubes right onto there, which usually help in reducing the amount of hemolysis because it's just a vacuum sucking into it. So if you've got a 10 ml syringe full of blood, you want to do it as fast as you possibly can to get it into these tubes because it will clot in the syringe. Obviously, this has no additive in it to prevent the clotting. So I just hook it up like this. You're always going to do blue, green, lavender, and gray last. Always. It's always what I've been taught. I've never done it anything differently. When you pop it on, it's going to fill all by itself. See that? I didn't do anything but pop it on there. And it's dripping, dripping, dripping. Make sure it's at the fill line and you want to invert. It's right at the line, perfectly filled, great for lab. Then you move on to the next one. It's going to do the same thing. We also have regular 21 gauge needles. You can use a 23, whatever. I prefer the 21 if you're going to do it this way if you don't have this, because this is obviously a bigger hole. If you use a smaller hole, it might be dripping into the tube rather than going in there freely, which then can also hemolyze your sample. You also don't want to jab anything. So if you're putting this in, don't push down on the plunger because that's going to break all of those cells, which will in turn hemolyze your sample. So I'll show you this way one more time, and then I will use the 21 gauge needle and put it in that way. So again, pop it on, it's filling, there's a black line right here, drip, 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 done. Take it off and invert your tube. That's it. We have just a 21 gauge needle connected on like normal. Push this down, take that off. Obviously be careful because there's a needle there. You're gonna pop it into the top. It's going to freely fill. You're gonna wait until it gets to the black line. Drip, 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 drip. Perfect. Immediately mix, especially your CBC tubes. These will clot if you don't mix them immediately. Gentle inversion, and obviously again be careful with your needle and lactic tube, and it's filling. Obviously you can see it fills a hell of a lot slower. Sometimes with the grays I will push a little bit. Obviously be very careful. You don't want to be jabbing it into the tube. Now it's at the black line and you mix. Safety on and you're done. That's it. It's very, very easy. A lot of the time people hemolyze samples because when they go to put it in their tubes, they will just jam the top of the syringe into the tubes, which then that's going to hemolyze all of your sample, and you wonder why you got a hemolyzed sample because you pulled it beautifully, you got an IV perfectly, the draw wasn't hard, it wasn't a hard stick, it wasn't a small vein, there was no trouble with you getting the actual IV or the blood draw. It was really how you put it in your tubes. So that was just a simple video. Hopefully that helped.